Okay, hi guys. Welcome to our channel. Today we're going to be interviewing our CEO, Tamara Glenn. We're going to ask her some questions that I think that you guys would be interested to hear. I think the first thing that we should ask is, how did she get started with ClearPath Health?
Hi everybody. ClearPath Health started on March of 2021, so we're almost a year into it. And it started because I've been in this field for almost 30 years, providing services to clients and being a director or an executive director of other agencies. And I felt like other agencies were not providing their services the way I want to provide services. So I really had a deep moment where I thought about wanting to create an agency where I could provide the services the way I wanted. So I created this agency to create what I say is raving fans. So I want to give employees great technology, great trainings, and great opportunities to provide the best care we can for our clients. I want our clients to be our raving fans by being able to offer them the services where they want it. So we're offering them services via telehealth at home, or they can come to our clinic. I want to create raving fans in the community, so we actually have participated in quite a few community events because I want us to be an integral part of the community to help get the message out there that mental health is just as important as physical health, and that you should not have any issues coming to get the help you want. And if you don't want anybody to see you walking into a building for mental health, then you can do it at home in the own privacy of your home in order to feel better. Basically is to offer the services at the level that the client wants, offer the best services possible for the client, and have a workforce that really believes in my mission and my message, and helps to get those messages out to the community as much as possible. So that's how ClearPath started. It was frustration with other jobs that I had that were not providing the services the way that I envision our services should be.
Okay, we love that answer. What are some of the challenges that you face as being a CEO of a mental health company?
That's a loaded question. There's a lot of challenges. First of all, starting any company is challenging because you have to have funding, you have to create the infrastructure, you have to hire people. But the biggest challenges have been, I've been lucky, and I always say knock on wood, I've been lucky that I have a great workforce that has been willing to take that chance with me to create the services that I want. And my directors came from other agencies that I had worked with because they believed in my mission. So the struggles have been Florida. If you don't know that, Florida is the fifth out of all states. Florida's last. So Florida's 50th in providing services, money towards mental health, meaning the government, the state, the funding that we get from the federal government for mental health services. Florida is last. So there's a lot of lack of money to provide mental health services. So the struggle has been, the biggest struggles have been dealing with the insurance companies, getting those contracts, making them believe in us and take a chance in us to be able to provide the services to the clients that we want to provide. So that has been the biggest struggle for me, because when a client calls and I don't take their insurance because their insurance hasn't contracted with me, it literally breaks my heart. Like, I don't want to say no to anybody. And that has been the biggest challenge, is having to say no to people because we don't have a contract with a particular insurance. We're working on getting all the contracts, but it's taking longer than I expected. And even getting paid from the insurance has been a struggle. So, the money piece, but that money piece comes with any new business. You're going to struggle with money. I'm blessed that I have people that have loaned me money and have helped me be able to continue to pay for our bills, so that I continue to grow. And we just opened another location in Port St. Lucie, and I'm blessed that it's working out. But yeah, the biggest struggle has definitely been the health insurance piece.
Okay. So what are your plans for ClearPath Health? Like, what do you see you guys doing in the future?
So my plan for ClearPath Health, I've said from the beginning, is we're taking over the world. I plan to continue to look at communities that are in need, that other providers are not providing the services that the community might need, and then go to those communities and open another location. That's why we went to Port St. Lucie, because we have heard that there was a need for mental health services that were available quicker than other mental health agencies were providing, and that was more in tune with the community. So right now we're in the middle of trying to find and define a location in Pasco, because I participate in a lot of community meetings to be able to know what is it that the community needs. So I'm hearing for all the community providers in Pasco that there is a great need in Pasco. We're fortunate, again, lucky, knock on wood, that we do have several clinicians that work out of that area. So we are already providing services to Pasco. But I want to make it easier to our clinicians to have a home base out there, and also to be able to have a place where clients can go in, because some clients want to be in person in the clinic, and it's really a hard drive from Pasco to here. So Pasco is next, and then we're moving on. The plan is to really continue to grow and more, and add more staff and add more services. So I also want to add targeted case management services, maybe other group therapy, and provide anything that the community really will love to use as a service that others might not be providing. So I'm open to anything, and I think the future is bright and there's no limit. So we're gonna go.
Okay, that's great. So I've heard through the grapevine that you are set to be a minority company. Is that true?
It is true. We just got the designation to be a minority, 100% minority-owned women business. So I am super proud of that. I wanted from the beginning, even when I talked to you about having struggled with money, I always said, I don't want anybody else to be my partner. I don't want anybody else to have a say in my company. And again, it's because I want to have 100% say in my company. So I didn't want an investor. I didn't want anybody that could tell me what to do with my company. So yes, we're 100% minority women-owned business, and we just got the designation from the state of Florida. So I'm super excited about that, and that will open more doors. I mean, if you don't know yet, I'm from Cuba, so I'm a Cuban descent person, and our communities, and not just the Hispanic or Cuban community, all of the minority communities, the Haitians, the anybody from the Caribbean, even some African Americans, they struggle with coming in looking for help through a mental health agency. So that's part of my passion, is I want to teach more. I want to get the word out into those communities that we're here to help. So I have joined like the Hispanic Chamber to be able to go back out into those communities and provide some education about, if you need help, we're here to help you, and to sort of decrease that stigma that comes for a lot of the minority populations about seeking help. I think, again, we need to get to that point where we think about mental health as health, and not just mental health. That if you have a broken bone, you go to your doctor. If you have depression, you come to mental health services. It is health, and whatever it takes to make you feel better should be available to you at all times.
Okay. So what advice would you give to someone who was thinking about starting their own mental health company?
Ooh, boy, have lots and lots of patience. It is, it's a challenge. I can definitely, if you want to reach out, I can help you. I know the steps, but you have to start with deciding what type of company do you want. Do you want a for-profit? Do you want a non-profit? And then from even there, do you want an LLC, or do you want a corporation? And then you have to get all that paperwork together. You have to get your own tax ID, and then good luck. This is the hard part, applying for Medicaid. Unless you really want to do, there's a lot of clinicians out there that want their own company and they just want to do private practice. Private practice is a little bit different because it's your own thing. You're not an agency, and that's a little bit easier because you just get panel with the insurance companies and you bill for whatever services, or people pay you cash. But if you really want to create an agency, it's a lot more complicated than that, because you have to get your Medicaid number, you have to get your MPI, and then you have to apply for all the insurances companies and get all your staff rostered and credentialed with all the insurance companies. So like I said in the beginning, I started in March. we didn't get our first official contract that we could bill for until December. So it is a very long process, especially here in Florida, again, because Florida doesn't have any money, so they're very picky. And it's just a process. It takes a long time to get it done.
Okay. Just to end this, is there anything else you want people to know about ClearPath Health?
I want people to know that ClearPath Health really is here to serve you and the community. So if anybody watching this feels like they have a need that is not met by any providers, or even ClearPath, if you said ClearPath doesn't have X that I want, call us. Talk to me, make an appointment. I am open to providing, especially other service providers. And I just went to a provider meeting yesterday where I said I'm willing to do anything to help the community. So anything that's creative that you think is a service that needs that we need to have that we don't have, I'm open to creating that program or hiring staff to do that service. We just hired a hypnosis therapist, and we're excited that we're going to be able to open that as a line of services for us. But anything that you feel as a person or as a provider, if you're watching this as a provider, that the community needs, call me up and let's have a conversation. And I'm willing to go. Like I said, I want to take over the world, so I'm willing to create any services that the community needs. That's the bottom line. I'm here to serve the community. So whatever the communities that we're in, whatever you need, we will create it.
Okay, well, thank you so much for your time.
Thank you for having me.